To keep the risk of decompression sickness very low, we need to keep excess nitrogen levels within accepted limits. But there's no way to measure the actual nitrogen dissolving into our bodies, so we use dive computers and dive tables. Dive computers and dive tables apply a mathematical model to estimate the changes in body nitrogen before, during, and after a dive. Based on the outcomes of thousands of dives, decompression models are highly reliable for the vast majority of people, most of the time. But they don't assess anything actually going on in your body, and they don't know if any predisposing factors apply to you. Because people vary in their susceptibility to decompression sickness, no dive computer or dive table can guarantee that decompression sickness will never occur, even though you dive within its limits. As a diver, you must accept that some risk of DCS remains. To help reduce and manage the remaining risk, the key is to always dive well within dive computer or table limits. And be a safe diver. Slowly ascend from every dive, no faster than 18 meters or 60 feet per minute, or slower as specified by your computer. Make a safety stop at 5 meters or 15 feet. All of these practices help keep you well within the model's predications. As a recreational diver, you always make no-stop dives. This means that at any time during a dive, you could ascend directly to the surface if you had to. To do this, you stay within your computer's no-stop limits, which you can access before the dive for planning. The deeper you dive, the faster you absorb nitrogen. So as you can see, the no-stop limits get significantly shorter as depth increases. Times differ slightly with different models, but these are typical. During the dive, your computer updates your no-stop time based on the time you spend at each depth. Your remaining time will be shortest at your deepest point, but it increases as you ascend because nitrogen absorption slows. Diving so you get more time by ascending to a shallower depth is called multi-level diving. This is one of the big advantages of dive computers. Tables base your time limit on your deepest depth, even if you don't stay that deep the whole dive, which is often not the case. Note that the exception to this is the ERDP-ML, which lets you plan multi-level dives. Let's look at how your limits might change during a typical dive. These divers want to dive to 18 meters or 60 feet, explore a bit, then gradually work their way upward so they stay well within no-stop limits and have 50 bar or 500 psi air left when they surface. During pre-dive planning, they scroll their no-stop times. Their computers show 140 minutes no-stop time at 12 meters or 40 feet, and 55 minutes at 18 meters or 60 feet. They decide they will descend to 18 meters or 60 feet, then start back up at 30 minutes. The dive goes as planned. After half an hour at 18 meters or 60 feet, their computers show 25 minutes no-stop time remaining. They head upward along the reef and level off at 12 meters or 40 feet. Their computers show 83 minutes no-stop time. This is a lot more time than they had at 18 meters or 60 feet, but their bodies have absorbed nitrogen, so it's less than the 140 minutes they had before diving. However, it's more no-stop time than they have air, so they end the dive with enough air to ascend, make a safety stop, and surface with a 50 bar or 500 psi reserve. Dive computers and tables' ascent rates are part of their calculations, so stay within these rates. Safety stops are not required for surfacing within model limits, but you make them for added conservatism well within limits. In an emergency, like an out-of-air situation, you would omit the stop, but otherwise make it. If you accidentally exceed a no-stop limit, on the other hand, you must make a decompression stop. In this case, you need the stop to release excess nitrogen before surfacing. Without the stop, you would exceed model limits and have an unacceptable decompression sickness risk. You'll learn more about emergency decompression stops in Section 5. After a dive, your no-stop times are shorter than before the dive. This is because your body still has excess nitrogen from the previous dive. We call the nitrogen from a previous dive residual nitrogen, and a dive made while you still have residual nitrogen a repetitive dive. When you make a repetitive dive, your no-stop limits are shorter because you already have nitrogen in your body. Your computer must account for this residual nitrogen as well as what dissolves into your body on the repetitive dive. You have to wait several hours without diving, usually 12 or more, before body nitrogen levels return to normal. After that, a dive isn't considered a repetitive dive. Although you still have nitrogen in your body after a dive, during a surface interval between dives, the nitrogen levels decline. As a result, the longer the surface interval, the more no-stop time you have on a repetitive dive. Your computer calculates your theoretical nitrogen levels continuously, so it is important that you use the same computer for all dives throughout the day. It remembers your residual nitrogen, so don't share or trade computers, and don't turn it off. Most models won't let you anyway. If you don't dive with the same computer continuously, it can't accurately calculate theoretical nitrogen. Diving without using the same computer for all dives greatly increases your risk of decompression sickness. And follow any additional manufacturer recommendations regarding the use of a computer for repetitive diving. Before using your dive computer, read the manufacturer literature completely. Dive computers vary in their features and layout, but as a minimum, virtually all tell you your no-stop limits before a dive. While underwater, you can read your depth, elapsed time, and your no-stop time remaining. An ascent rate indicator guides your ascent speed, and emergency decompression information comes up if you accidentally exceed a no-stop limit. Between dives, you can read your surface interval time and recall previous dive information. When you're ready to plan your dive, you activate it by pressing a button or touching contacts like this. With your buddy, agree on a maximum depth and time based on the scrolled no-stop limits. Remember that repetitive dives have shorter no-stop limits, and that shallower dives and multi-level dives have longer ones. Plan a maximum time and your air use limits. You often have far more no-stop time than your air will last. You turn the dive based on whichever limit you or your buddy reaches first: time, air supply turn point, or remaining no-stop time. You may want to note these on a slate to reference during the dive. There are 6 guidelines to follow while diving with your computer. 1. Dive the plan. Don't go deeper or stay longer than planned just because your computer will let you. 2. Stay well within computer limits. Never let your remaining no-stop time get close to 0. 3. Follow the most conservative computer, yours or your buddy's. 4. Watch your SPG and manage your air supply. 5. When you can, start at the deepest point and progress shallower. When making more than one dive, make the deepest dive first. This gives the most no-stop time and is considered a conservative diving practice. And 6. Ascend slowly within your computer's ascent rate and make a safety stop. Dive computer failure is very rare. Most self-check and confirm adequate battery power when activated. If one fails during a dive, however, you have 2 options. The first is to ascend, make a safety stop, and end the dive. By diving well within limits, you should be within acceptable theoretical nitrogen limits. If you have 2 computers and have been diving with both of them, your second option is to continue the dive with the working computer. If your computer fails between dives and you've been diving with two, you can make another dive using the one that works. If you've been diving with one computer and it fails, you may be able to continue diving by using your time and depth information with dive tables, a depth gauge, and timer. Otherwise, you need to wait 12 hours before diving again with a working computer.
Often, you make a dive, spend some time topside, and then plan your repetitive dive based on the no-stop limits your computer shows. But not always. Sometimes, you know how deep and long you want both dives to be, so instead you plan how long to wait between them. This is called finding a minimum surface interval. Imagine you and your buddy are diving on a wreck. Your first dive was to 18 meters, or 60 feet, for 40 minutes, and you plan to make a second to 15 meters, or 50 feet. You want to dive for 45 minutes, and based on experience, you know you have enough air to do that. Make a safety stop and surface with an adequate reserve. To stay well within limits, you agree your computer should show at least 50 minutes no-stop time before you start. So, how long do you have to wait after diving 18 meters or 60 feet for 40 minutes to have 50 minutes no-stop time at 15 meters or 50 feet? One way to find out is to simply scroll your no-stop limits periodically until your computer shows the time you want. This sounds imprecise, but as you gain experience, you get a feel for how much no-stop time you gain during surface intervals. A second way is to use your dive computer's plan mode. Not all computers have this feature, but with some, after a dive, you can enter surface intervals and depths, and it shows the no-stop times. See the manufacturer literature or your instructor about this feature. You can also use a dive planning app, the RDP table, or the ERDPML, to find minimum surface intervals. These won't exactly match your dive computer, but it will give you a good approximation of how long you'll be at the surface. When planning, scroll your computer's no-stop times to confirm you have the time you want. The decompression models used in dive computers and tables are based on diving at sea level. You are under less pressure when you are higher up, so flying after diving and diving at altitude can increase decompression sickness risk. To address this, the dive medical community recommends waiting at least 12 hours before flying after a dive. If you make more than one dive or dive several days in a row, wait at least 18 hours. Flying after diving recommendations change periodically. Follow the current recommendations. You need to use altitude diving procedures for sites at 300 meters or 1,000 feet elevation or higher. You set some computers for altitude and some automatically adjust. See the literature for yours. With most dive tables, you use a special table that converts your actual depth to theoretical depth that adjusts for the pressure difference. Your instructor will help you with these options if you'll make your open water dives at altitude. You've learned that you want to stay warm to avoid hypothermia and to dive relaxed to avoid overexertion. Getting cold and strenuous activity may also increase decompression sickness risk. Although you want to avoid cold and strenuous dives, if you find yourself colder or working harder than expected, be even more conservative than usual. Using the RDP table or ERDPML, calculate cold or strenuous dives as 4 meters or 10 feet deeper than their actual depth. Safety stops may be especially prudent. If you accidentally exceed a no-stop limit, your computer will show emergency decompression stop depths and times. Don't ascend above the indicated stop depth. Your computer will show you when you can ascend to the surface or the next stop if you have more than one. Although it's important to complete emergency decompression stops, don't run out of air trying to do so. If you're low, complete as much of the stop as you can, but save enough air to surface and exit. After you're up, relax, breathe emergency oxygen if available, and monitor yourself for decompression sickness symptoms. Don't dive for at least 24 hours. Many dive computers will lock into an error mode for that long if you don't complete a required decompression stop. Lung overexpansion injuries and decompression sickness have the same first aid. So we don't worry about distinguishing between them when we help a diver. The dive community groups them both under the term decompression illness, or DCI. Follow the steps you learned in Section 3 for helping an unresponsive diver. Monitor the diver's breathing and give CPR as needed. Contact emergency medical care, including the local diver emergency service if there is one. Keep the diver lying down, breathing emergency oxygen. Lay an unresponsive, breathing diver left side down, head supported, like this. Give the diver aid until emergency care takes over. Nearly all DCI cases require putting the diver back under pressure and extended therapy in a recompression chamber. Don't delay first aid and getting the diver to treatment. The faster treatment begins, the lower the risk of permanent residual symptoms. Under pressure, nitrogen and oxygen have an intoxicating effect called gas narcosis. It's not directly harmful, but it can impair good judgment and coordination. The signs and symptoms include feeling intoxicated, loss of coordination, slowed thinking, slowed reactions, inappropriate laughter, depression, a false sense of security, a disregard for safety, and when under stress, anxiety and/or panic. Narcosis affects people differently, but most divers begin to notice it at depths approaching 30 meters or 100 feet. Being tired and the use of drugs and alcohol can make it noticeable even shallower. Diving in cool water, darkness or limited visibility seem to make it more noticeable, while diving experience seems to reduce its effects. Generally, narcosis isn't likely to be a significant issue on dives shallower than 30 meters or 100 feet. If you do experience it, though, ascend to a shallower depth. It usually passes quickly. During your open water dives, you'll practice navigating with an underwater compass. This basic skill helps you save air and know where you are in relation to your exit point throughout the dive. A standard compass looks like this. The north needle or indicator always points to magnetic north. The lubber line is always your travel direction. The bezel rotates so that you can set the index marks over the north needle, and the heading references allow you to record directions. Hold and swim with your compass like this. Level, with a lubber line aligned with your body center line. Look over the compass as you swim with it. For console-mounted compasses, hold it like this. To set it, point the lubber line in your desired travel direction and let the north needle settle. Then rotate the index marks over the needle. Now, keep the needle within the marks and the lubber line in line with your body as you swim. If you turn off course, the needle leaves the marks. Stop, turn back onto course, and then continue. While you navigate, your buddy maintains contact and watches the depth. To return on a reciprocal course, rotate the bezel 180 degrees and then turn until the needle's within the index marks. Now you're facing the way you came. Some compasses have 2 sets of index marks, so you don't have to reset the bezel. Just use the other set. A growing number of dive computers have electronic compasses. They operate similarly, but have different displays. See the manufacturer and your instructor about using yours if you have one. Throughout this course, you've learned about the limits you're responsible for staying within as a newly certified PADI open water diver. Let's summarize some of them. You were trained to a maximum depth of 18 meters or 60 feet, or the actual depth you've reached if shallower. With additional experience and training beyond the open water diver course, the maximum depth for recreational diving is 40 meters or 130 feet. You are also trained to dive in conditions as good as or better than those in which you train, within the no-stop limits of your dive computer or tables. You're qualified to participate in the PADI Advanced Open Water Diver course, Discover Local Diving Program, and many, but not all, PADI Specialty Diver courses. Ultimately, it is your responsibility to set your limits for each dive based upon your assessment of your skills, comfort level, and the dive conditions. One challenge new divers sometimes face is how to stay involved with diving. The dive community has found 3 things that will help you do this. First, involve yourself in social settings where you can meet other people to dive with. Second, go to different places to dive. And continue to learn by continuing your diver education. It's easy to meet friends to dive with. Start with your PADI resort or dive center. They usually have clubs and activities. So jump in and join the fun. Meet divers online with Scuba Earth and other social sites. Attend local dive shows and invite some of your non-diving friends to become divers. You also meet people through group dive travel. Your local dive operator likely organizes local and distant dive outings, as do dive clubs. With experience, you'll start planning individual trips too. Set training goals. What do you want to accomplish as a diver? Then, take dive courses that take you toward your goals and that interest you. This is another way to meet divers, and you can often package a course with dive travel. It's also been found that divers who invest in their scuba kit continuing diving and get more out of it. This isn't surprising. As you learned earlier, your own gear is the gear you prefer, adjusted for you, and suited to the diving you like. The purpose of the PADI system of diver education is to help you dive safely, but also to help you continue to enjoy diving. It provides a clear path with choices for growing in and enjoying diving in the ways and areas that you want. You may even already be thinking about one day becoming a PADI open water scuba instructor. By continuing your education with the PADI system, you learn new skills, make new diving friends, learn more about different kinds of equipment, and visit new places and dive sites. Talk to your instructor or dive operator about your interests, and visit PADI.com regularly for updates and additions to what the PADI system offers.